Oh, hi everyone. It's me, Obscenity. I'm here to talk to you about what is fact and what is fiction about HIV. Let's get started. HIV. What does it mean? Human immunodeficiency virus. But what does that tell us? It tells us it's a virus that attacks our immune system, causing it to be deficient or lacking, and then it's only transmitted from human to human. People ask, what happens when HIV gets into the body? The virus enters the bloodstream and attacks the immune system, specifically the CD4 cells, which are our fighter cells. The HIV turns the CD4 cells into a sort of copy machine, which makes more and more copies of the virus. The new copies then attack other CD4 cells, and the cycle continues. Eventually, the CD4 cells die, leaving our immune system depleted and with no defense against infections. There are 3 stages of HIV infection. The acute phase, which happens within the first 3 months. During this phase, there's a large spike of HIV in the body and a dramatic decrease of the CD4 cells. Our bodies are a lot stronger than most people realize and will begin to fight off the virus. We call this the asymptomatic phase. During this phase, a person may not show any symptoms, but their immune system is working extra hard to not only fight HIV, but any other infections that come along. After several years of fighting, the body eventually gives up. The immune system becomes depleted, and there's another large spike of HIV. This phase is called AIDS. So what is AIDS? AIDS stands for Acquired Immunodeficiency Syndrome. So why do they say acquired? I always like to explain it like this. You're never going to go out and have unprotected sex with someone and get AIDS. You would get HIV. AIDS is just a term that we use to describe advanced, untreated HIV. See the difference? HIV is transmitted 3 ways. First, there's blood. Blood transmission happens when there is direct contact in a person's bloodstream with HIV-infected blood. For example, an accidental needle stick or sharing needles during intravenous drug use. The next is mother-to-child. Mother-to-child transmission can happen in the placenta during delivery or through breast milk. However, this is less common these days thanks to advancements in medication. We'll get to those in just a minute. Let's get back to the bodily fluids. Did I say bodily fluids? Yes! Blood and breast milk are bodily fluids. The other 3 bodily fluids that can transmit HIV usually come from sex. Those are vaginal fluid, anal fluid, and semen. Now, there are still a lot of common myths about how HIV is transmitted. Like, you can't get it from a blood transfusion anymore because all the blood in the blood banks is tested for HIV before it's ever used. Some people still think you can get it from mosquitoes. No, not swimming pools either. Now, there can be small traces of HIV in saliva, but you don't need to worry about that unless you commonly drink gallons and gallons and gallons of someone's saliva. So how do we prevent spreading HIV? Of course, we should all be having protected sex, but testing is essential. Anyone who is sexually active and has anonymous partners or multiple partners should get tested every 3 to 6 months. Don't forget, BAO offers free and confidential testing Monday through Friday. PrEP is another option. PrEP stands for pre-exposure prophylaxis. It's a once-a-day pill, it's 99% effective, and prevents the virus from ever getting into the body. Proof. People who are HIV positive should take their medication every day as directed. Because of advancements in medication, an HIV positive person can live a long and healthy life. The medications can fight off the virus enough to lower the levels of HIV in a person's body to be considered undetectable. If a person is undetectable, then they can no longer pass the virus to other people. Whew, it's a lot of information, right? But look, here's a few things to remember. Get tested regularly. Remember that HIV is no longer a death sentence. If you feel you're at risk, talk to your doctor about PrEP. Remember, undetectable means untransmittable, and don't drink gallons and gallons of somebody's saliva. Oh, hi everyone. It's me, Obscenity, and I am here today to you, and I'm here to talk to you today about HIV. I am going to talk about, what's the, gosh! Okay. But it gets in the blood and does that.
Yeah.
Okay. Line! When HIV enters the body and gets into the bloodstream, so what happens when a person is infected with HIV? The virus... There are 3 Damn it!